Good evening and welcome to the Thai PBS World. It's a tough mission for medical staff around the world who fight against sharp rising of COVID-19 around the world. But for medical doctor in Thailand who's been through many crises like Ebola, MERS, SARS, I asked him why he thinks COVID-19 is the toughest. We can see how the medical doctors are working against time to race against COVID-19 in Thailand, in China, in many countries. What's the situation of the readiness of the number of beds in Thailand? Have you got information whether we have enough to cope with perhaps more patients, more cases?
There is one truth, that is, if we let the disease spread without control, there will be no countries that will have resource available for the situations. So, on one hand, we have to prepare the hospital. On the other hand, we have to try to slow down the spread of the disease as best as we can. Because if we do not do that, no matter how many beds we have, that will not be enough. Okay, so during this time we have to fight two wars. One war is trying to slow it down. On the other hand, another war that we are fighting is that we have to prepare our health facility, our hospital facility, as best as we can. Even before COVID-19, our hospital is already crowded. So what we are trying to do is we're trying to manage our bed as best as we can. If we have unnecessary operation or procedure that we have to do, we try to delay those. So I believe that for any countries we are going to have the same kind of plan, because no countries will have the bed for the situation like this. We are going to have enough our medical staff just for a normal routine work. So what we are doing at the moment is we are trying to make shift from routine operation into what we call emergency mode. The hospital will try to empty their ward as best as they can, so that they can prepare a certain number of beds for the patients.
Yes. But in terms of the number of doctors, nurses, are we soon going to face shortage of supplies of medical staff in Thailand?
I hope not. I hope not, because we have so many sectors that can come in and help. Not just Ministry of Public Health, but several ministries also have large hospital like Ministry of Higher Education, Ministry of Defense, and even Ministry of Interiors also have hospital or health facilities to help us. Or even private sectors. We have a lot of private hospital that now also taking care of the patient as well. So it is not only public sector that's work on this, as I mentioned earlier, but everybody is now doing their part to help the situation of their own countries.
You said you've been through many challenges, this kind of tough situation, fighting against epidemic from H1N1, from the flu, MERS, SARS, and until this one, COVID-19. Is this one the toughest?
Yes.
From your experience?
Yes. Yes. When I was younger, I was like my first experience was SARS. During that time, our work is just
2002, 2003.
We have about 10 plus or minus. That's our cases, and it doesn't take long before we contain it. MERS, we have 3 cases of MERS, but every case we were able to contain it. Even influenza, I was still very young and don't have to take that much responsibilities, so it's fine. Although it's stressed a little bit, but fine. But now my decision may affect 60 million people, so I have to be careful with those decisions.
Yes, but we all shouldn't be disheartened, do we? And we can look at the bright side from South Korea, from China, and what can we learn from them in order to contain the outbreak?
There is one good thing about this kind of communicable diseases, and every day we can have hope. Let's give one good example. Let's say if our situation is getting bad, and we at today, for example, if we have 10,000 people infected, 10,000 cases, and if these 10,000 cases know what they have to do to stop the disease, if they stop spreading the disease in 14 days, we will have 0 case. Because if they stop spreading today, there will be no more cases, right? So actually, I'm not sure if we are fighting the virus or we are fighting the unknown. I mean, the unknown is Thai people don't know what they have to do. If they know, I believe that they want to stop the disease, the virus as well. So I believe personally that if we want to stop this disease, we have to inform every Thai people of what they should do if they come down with common cold. They don't have to care what infected them. What they have to care is they should stop the spreading of the disease. No more cases that will get the disease from them. If we can do that, no matter how bad the situations will be, we can always stop it at any times. So, is it hard? Yes, it is. But I think we still have hope, I think.
Dr. Thanarak emphasized that every day we can have hope, but we are now fighting the unknown, and Thai people should try to stick to social distancing and wash our hands right now to take care of ourselves and not to spread virus to others. And that's all from Thai PBS World tonight.